Did you know that every year, hundreds of thousands of people undergo tonsillectomies? Yes, that's right. The surgical removal of the tonsils is one of the most common procedures performed, especially in children. But what exactly are tonsils, and why do we remove them? Tucked away at the back of the throat, tonsils act as the immune system's first line of defense. Imagine them as sentinels, guarding the entrance to the respiratory and digestive tracts. They help detect and fight infections by trapping harmful bacteria and viruses that enter through the mouth or nose. However, despite their beneficial role, they can sometimes cause more harm than good. Tonsils are made up of lymphoid tissue, similar to the lymph nodes found in the neck, armpits and groin. This tissue is rich in white blood cells, which are crucial for fighting infections. There are three groups of tonsils. The palatine tonsils, which are the most visible when you say "ah", the pharyngeal tonsil, commonly known as the adenoid, located at the back of the nasal cavity, and the lingual tonsils, situated at the base of the tongue. The common issues that might lead to the removal of tonsils, a procedure known as tonsillectomy, include recurrent tonsillitis, which is repeated inflammation of the tonsils caused by infections. Another reason is sleep-disordered breathing, including obstructive sleep apnea, where enlarged tonsils block the airways during sleep. Not to mention, there can be complications like peritonsillar abscess, a painful collection of pus that forms behind the tonsils. A tonsillectomy might be recommended if tonsillitis occurs frequently, typically more than 7 times in 1 year, or if it significantly interferes with daily activities. Despite the removal, the immune system can still function effectively. Other tissues in the throat and surrounding areas compensate adequately for the loss of the tonsils. In summary, the tonsils are vital components of the immune system, stationed at the gateway to the body's respiratory and digestive tracts. They help detect and combat pathogens, but can become problematic, leading to issues like recurrent infections and breathing difficulties. When these problems persist and interfere significantly with quality of life, removal of the tonsils might be the best course of action. This procedure, though common, marks a significant decision often aimed at enhancing overall health and well-being.